Austin?
Yes.
Hey, my name's Megan. I'm a nurse practitioner student with Henderson State University. Do you mind if I do your health history assessment today?
Sure.
Okay. Can I start out and have you tell me your name and your date of birth?
It's Austin Davis, and my birthday is February 6, 1995.
Okay. Well, Austin, what brings you into the clinic today?
So I've been having some increased allergy symptoms. My normal medications aren't seem to be working as much as they have in the past, and I was hoping to get some help with that.
Okay. What kind of symptoms are you having?
So I've got a runny nose, sneezing, cough, itchy, watery eyes, congestion, and hoarseness.
Okay.
Are the biggest ones.
How often do you seem to have these symptoms?
Probably 2 or 3 times a week.
Okay. Do you take any medications for these symptoms?
So I take Claritin every day, and then kind of as needed, I'll take Benadryl, a nasal spray, and an inhaler, just kind of as needed.
What kind of inhaler do you take?
It's an albuterol inhaler.
Okay. What about Benadryl? How much do you usually take of it?
I don't take it all the time, just when my symptoms are really bad, and usually I'll just take 1 tablet. I think it's 25 milligrams.
Okay. And what about the nasal spray? What kind of nasal spray?
It's a Flonase steroid nasal spray, and again, I only use it when my symptoms are kind of bad.
Okay.
Maybe once a week, if that.
Okay. Are you allergic to anything?
So I was allergy tested several years ago. I was told that I was allergic to cats, dogs, and dust, and then several outside allergies, but those were kind of lower on the scale.
Okay. How often do your allergies get flared up?
I would say like I have like a runny nose or sneezing probably 2 to 3 times per week, and then occasionally it's a little worse than that, but maybe once every other week or so.
Okay. Are you exposed to any of those things that you're allergic to that you know of?
Of course, the outside allergies, every day. But I don't.
Mm-hmm.
I work indoors, and so I'm not constantly exposed. And then I have 2 dogs at home, and I'm exposed to them every day, of course.
Okay. Have you ever? I know you said you were allergy tested. How long ago was that?
Probably maybe 10 years.
Okay.
Or maybe even more than that.
Okay. Did that allergy doctor, when you were allergy tested, did they do anything for you, prescribe you anything?
He gave me some samples of an antihistamine, and then he prescribed the inhaler that I have,
Okay.
and then he also prescribed me allergy shots, like injections in the back of my arm, and I did those for about a year, but I didn't really seem to notice much change with those.
Are you using the same inhaler that you got 10 years ago, or have you got a new one since?
I got a new one probably 3 or 4 years ago.
Okay, but that's the newest one that you
Correct,
have?
yes.
Okay. What about the antihistamine? Do you still take it?
No, he only gave me a few samples, and I felt that the Benadryl was just as effective, so I just used it instead.
Okay. What about the shots? Did they seem to help?
Not really. I didn't really notice much change, and plus it was pretty expensive, and at the time I was on a little tighter budget, so I couldn't really continue to do that.
Okay. Well, if you don't mind, I'm going to just go through like a quick history of you. Can you tell me, have you had any head issues, any head trauma, any injuries?
A few years ago, I had a skin cancer spot removed from my head.
Okay.
It was done at a dermatologist's office.
Okay. Do you follow up with that dermatologist still?
Not anymore. She said that it looked good and that I could just come back kind of as needed.
Okay.
And I haven't had any issues come up since then.
Okay. What about hearing issues? Any problems with your ears or? Okay. What about eyes? Any vision changes? Any?
When my allergies get flared up really bad, I'll have like itchy and watery eyes.
Okay. Do you use any eye drops?
No, I can't tolerate any eye drops. I don't like anything touching my eye.
Okay. Besides your nose being runny with your allergies, any other nose problems?
Other than the congestion and runny nose, no, nothing else. And then the sneezing, of course.
Okay. What about, do you have any mouth issues, dental issues?
No.
Okay. What about throat? Any throat issues besides the sore, hoarse throat?
Yeah, that's it. Just the hoarseness with allergies.
Okay. What about any cardiac issues? Any heart problems?
No, none.
Have any respiratory issues?
When my allergy symptoms really flare up, I get kind of short of breath and kind of feel like my chest is tight. And when that happens, I use my inhaler and it seems to help.
Okay. How many puffs of your inhaler do you use?
Usually 2,
Okay.
and that seems to do the job.
Okay. What about any abdomen issues? Any
My stomach's fine.
surgeries?
Other than, like I said, other than the acid reflux, I use Tums for it occasionally, but other than that, no, everything's been fine.
And the Tums seem to work?
Yep.
Fine.
I use those probably maybe once a month, if that.
Okay. What about any urinary issues? Any problems?
Mm.
What about any bowel problems?
No.
Not that you knows. What about any bone issues, or have you ever broken a bone?
I broke my right arm when I was a kid. I was in the 6th grade. My friend and I were driving around in a go-kart, and we turned it over, and as it was flipping, I broke my arm.
Okay. No, any mobility issues? Get around just fine?
Yeah, get around fine.
Okay. Next I want to ask you about do you have your social history? Any
Okay.
drug use?
No drug use.
What about alcohol?
Socially, with my friends, maybe once a month, if that. I'm not a big drinker at all.
Okay. What about tobacco? Do you smoke any tobacco, or you use
No
smokeless
tobacco. No, never.
Okay. I'd also like to ask you about your family history. Can
Okay.
you tell me about your mom's medical history?
So my mom has migraines, and she has a pretty extensive history with skin cancer. But other than that, she's healthy.
Okay. What about your father?
So my dad, I don't know that he ever goes to the doctor. He seems to be in pretty good health, but it's probably been 20 years or more since he's seen a doctor.
Okay. What about your paternal grandparents?
So my paternal grandparents, my paternal grandmother, she's pretty well, other than some vision issues. She has cataracts. And my paternal grandfather, I don't know because he left when my dad was a kid, and I never met him.
Okay. What about your maternal grandparents?
My maternal grandparents are both deceased. My maternal grandmother was a very brittle diabetic, and she passed away at 62. And my maternal grandfather, he passed away at 64 from complications from cancer.
So I know you said you take the medications for your allergies. Do you take any other medications?
No medications other than the ones I told you about.
Okay. And no other allergy, like no drug allergies?
No.
Okay.
Just
No
the
food
seasonal
allergies?
allergies and pet allergies. No food allergies.
Okay. What do you do for work?
I'm a nurse practitioner.
Okay. You work in an office most of the time?
Yep.
Okay. Well, thank you for letting me do your health history today. We'll get your vital signs, and then we'll see what we can do for you today, okay?
Thank you.
Thank you so much.